Hi friends. If you clicked on this video, then you're likely suffering from the debilitating pain of spinal stenosis. I get it. This is my husband. And just a few months ago, he couldn't walk the dog, he couldn't cook, do dishes, and he certainly couldn't travel due to the pain from his lumbar stenosis. We were certain that surgery was going to be the only way that he could get back his quality of life. That is, until we discovered a few stretches that made a world of difference for him. Now, while we do his stretches in a Pilates studio on Pilates equipment, I'm going to show you some stretches that you can do at home that will give you similar opening of the lumbar back. Quick disclaimer. Every body is different, every back is different. If any of these movements cause any sort of pain or aggravation, stop doing them. And if you like what you see so far, I'd really appreciate if you could give this video a like. And if you want to see more content like this, with gentle workouts for those of us who have to be a little bit more careful with our delicate bodies, then hit the subscribe button because I upload new content often. So we're going to start lying down. I've got my head on a pillow, which is not required, but I do encourage it, especially for spinal stenosis, and my knees are bent. And then I'm going to take one knee and pull it right into my chest while I keep the other knee bent. You can straighten the other leg if you would like. However, what I like about keeping both knees bent is that it keeps the low back more rounded, which is really what we want to do to relieve some of this back discomfort. So I'm pulling the knee into the chest, and I'm thinking about using my abdominals to press that low back into the mat. And I keep that feeling. So it actually makes it a more active stretch. And then I'm going to switch legs. I'm going to pull my opposite knee in towards my chest while I use my abdominals to press that low back into the mat. And I'm going to hold it, and I'm just going to let that low back open into the mat. And I'm going to hold for just a couple more seconds, and then I'm going to relax. And then I'm going to pull both knees into the chest. And the same thing, I'm going to really use the muscles behind my belly button to push that back waistband in towards the mat. Use those abdominals to open that low back and to get a deeper stretch. I'm going to hold this for just a couple more seconds, and it feels so good. I'm going to release and do another one of those. Knees into the chest, low back towards the mat. And breathe for just a little bit longer. And then I'm going to relax the legs. Now for this next exercise, we're going to come up to seated. And a very safe way to come up to seated is to roll onto your side. Come right back up to seated. And then I'm going to sit. And then we're going to do the spine stretch forward. So I'm seated, legs straight-ish in front of me, and my arms out in front of me as well. I'm sitting up tall. And then I'm curling the chest forward to right in between my knees. Feels so good, just opening up that back. And I straighten back up. And then, similar to how we did the prior exercise, we're going to curl the chest forward, and we're going to use our abdominals to press our low back back. So I'm thinking chest forward, low belly back. Feel that opposition. And I want to clarify, to get the maximum benefit of this stretch, I don't want to hinge forward. You're not going to hurt yourself hinging, but where you're going to get the most relief is if you can really round that low back. So if you notice, my chest is curling forward and my low belly is reaching back, almost as if I were seated against a wall and I was trying to keep my low back touching the wall as my chest came forward. Nice rounded spine as I try to get that head just a little lower. And I'll straighten right back up. For the next exercise, I'm going to be lying back down. Knees are bent. And for this, I'm just gonna bring some gentle rotation to the lower spine. I'm gonna rotate both knees to the right, just a little bit. And then I'm gonna rotate them back to center. And I'm gonna rotate both knees to the left and bring the knees back to center. Now, as I'm rotating my knees to the right, my left hip can and should pick up a bit. You really want to try to keep your knees at the same level. Knees even, I should say. And then I keep going, just feeling opening of the low back and gentle engagement of the obliques, which are along the side of my stomach. My chest is staying open, and I'm doing just a couple more of these. Now, it's very important that we keep these rotations small. You don't want to go into a full twist like this. That could be very aggravating to your back. You just want to gently rotate and bring some movement to that lower spine. And I hope this is feeling really good. And let's do just one more set. Exhale back to center. Inhale, legs to the left. And exhale back to center. So for the last exercise we're going to do here, I'm standing against a wall, leaning my back against it. My feet are comfortably forward. And I'm reaching my low back towards the wall as I curl my chest forward. Keep reaching that low belly back. And you can keep coming forward as long as you keep reaching that low belly back. It will leave the wall, but it is still reaching for that wall. What I'm trying to give you is a feeling of opposition here. And you can keep coming forward, just opening that low back. Let the weight of the chest help to open that low back. The chest will dangle, the belly is lifted, the arms are circling, and you're just gonna hold for a couple of breaths. Head is dangling, and then you're gonna come right back up to standing. Thank you so much for watching this video. I hope it helped your back feel better. If you have any feedback, I would love to see it in the comments below. Thanks again for watching.